Hello everybody, and welcome to the Teaching New Skills course. The content of these slides was compiled by myself, Dr. Leslie Neely, and Dr. Catherine Hoffman. I want to mention that this work was supported in whole or part by a grant from the Texas Higher Education Coordinating Board, the THECB. The opinions and conclusions expressed in this document are those of the authors and do not necessarily represent the opinions or policy of the THECB. So I want to start with discussing ABA, also known as Applied Behavior Analysis. Some of you may know what ABA is, or you may have never heard of it. ABA is technically defined as the science of systematically applying interventions based on the principles of behaviorism to improve socially significant behaviors. As behavior analysts, we focus on modifying the environment to help individuals be successful in daily life. We also rely on evidence-based interventions and take data on the progression of those behaviors so that we know that the interventions are working. A very important element of ABA includes the ABCs of ABA. The ABCs refer to terms we use to describe one's behavioral interaction. So we typically take a behavior and break it down into three parts. The first is the antecedent, or what happens before a behavior. The second part is the behavior itself, or what does the learner or individual do. And the third is the consequence, or what happens after a behavior. We behavior analysts find that what happens right before and right after a behavior can change whether the behavior happens at all, or changes whether the behavior will occur in the future. The ABCs of ABA also guide us when we look to intervene for a certain behavior. In particular, the consequence, or the third term, can encourage the behavior to happen in the future or reinforce the behavior. It could also discourage the behavior from happening again, or what we would call punishing the behavior. So I want to note that we don't talk about reinforcing or punishing a child, but actually a behavior itself. And also, consequence don't always mean that something bad happens. For example, if a child sees his mom for the first time in a week, which we would term the antecedent, he might hug his mama and tell her that he missed her, the behavior, and she might return the hug and give him a kiss, the consequence. If he hugs his mom more in the future, we would say that this child's hugging behavior has been reinforced by the mom's hugs or the consequences. So one of the best things about using ABA to teach is it allows us to focus all of our attention and efforts on the behaviors we want to see and minimize our attention and efforts to the interfering behavior. This is called a reinforcement-based approach. We want to reinforce or encourage appropriate behaviors and ignore and minimize efforts to the rest of the behaviors. So to get started in ABA, we must first identify the behavior. All of you indicated that you are interested in working on either an academic or an adaptive skill with your child. Before we start talking about the different interventions, we need to identify and define the behavior that you want to work on with your child. These behaviors should relate to functioning in an educational setting or daily life. Here are two examples that represent academic and adaptive skills used in an educational setting or in one's daily routine. So in an academic setting, you might target counting change. This can contribute to the successful purchases of any items, which in turn can promote more independent daily living. If you're looking at adaptive skills, you might focus on potty training, which can lead to more independence. So I want you to pause the video and take a minute to write down 3 goals or desired behaviors you would like to work on with your child. When you meet with your BCBAD, they can help you prioritize these goals and choose the most crucial goal to begin working on first. So here's what you can expect during your meetings. During the first meeting, your BCBA will want to identify one behavior with you and define it so that it is observable or able to be seen, and measurable. Here are two examples of defining behavior in observable and measurable terms. So for example, instead of saying, "he is paying attention," an observable behavior might be, "he is sitting with his eyes oriented towards the teacher." In addition, instead of saying, "she is having a tantrum," you might define that tantrum and say, "she is flopping on the floor and crying." So I want to remind you we are only focusing on one behavior at a time so that we can devote our attention specifically to that skill. When that skill is mastered, we will then move on to another behavior. So your BCBA will want to define the behavior so that they can take data on it and make sure the intervention is working. Data can also be helpful in identifying when to make changes to an intervention. It has also been shown that if decisions are made based on impressions of the progress and not hard data, we tend to overestimate the ability of our child or learner. In addition, when data is used to guide instruction, students or learners make greater gains. So how might you prepare for the meeting with your BCBAD? So after defining the behavior, go ahead and observe your child in the natural situation where the target skills should occur. So for example, completing an academic task at the kitchen table, or if you target washing hands, you might ask your child to wash their hands and see what they do. Make sure to record your child's response, so what they did, what they said, and you could also take a video. These notes will help you and your BCBAD create an intervention that targets your child's current academic skills and adaptive skills and promotes the progression of those skills. It will also help your BCBAD get to know your child. Although notes are useful and helpful, it is preferable to be able to take a video. So we do encourage that you try to take a video. So we will now discuss some basic information you will need to know for the first meeting. These next slides will provide you with some information, but please feel free to jot down some notes or questions to ask your BCBAD. So after identifying the most crucial skill that you would like to work on with your child, we will develop an intervention to both teach the new skill and reinforce the new skill. We will begin with something called a preference assessment. The preference assessment will allow us to identify what might serve as reinforcement for your child. This can be in an indirect or direct format. We will then incorporate the following strategies for any of the interventions we develop: a task analysis, pairing the environment, prompting, and reinforcement. So we will begin with discussing the implementation of preference assessments. Preference assessments are tools that we use to understand what motivates your child. So why is a preference assessment important? Well, preference assessment can help us to increase your child's rate of learning, your child's motivations, and it can help us identify those child motivations that are unique and individualized to your child. It'll also help us to identify what is motivating your child in that moment, as motivations tend to shift day to day or even hour to hour. So there are two types of preference assessments. The first, an indirect preference assessment, is formatted as an interview. In the interview, we want to ask parents, teachers, and others what they think the learner really likes. For example, the Reinforcer assessment for individuals with severe disabilities asks a series of questions that a parent might fill out to help identify what type of preferences your child has or what type of things that might be reinforcing to them. The second type, a direct preference assessment, focuses on observing the learner and taking data on what they like. It allows the learner to tell us what he or she likes through his or her behavior. So there are two types of direct preference assessments that can be implemented. The first is called a free operant assessment. In this, your child is given access to items and the duration of time spent playing with each item is recorded. The item with the longest duration of engagement is the highest preferred. The second type of assessment is called paired choice. In this, your child will be given a choice of 2 or more items and asked to pick one of the items. You go through a series of choices and pairings, and the item that is picked the most is identified to be the most preferred. So we use these highly preferred items to keep motivation high. In order to keep motivation high, we want to make sure we reserve these highly preferred items for these specific task and time periods. Keeping in mind, motivations can change over time, so we need to conduct periodic free operant preference assessments or paired choice preference assessments so that we can identify what they are willing to work for. In fact, right before a single session, we can offer the paired choice or forced choice preference assessment to identify what they're willing to offer or work for at that particular moment. So you might do this by offering more than one item when delivering preferred items. Do you want to work today for bubbles or a book? So now that we have identified what our child is willing to work for or what is going to be reinforcing for our child, we want to pair the environment and make the environment fun. So what is pairing? Pairing is the delivery of highly preferred items to the learner in a new environment. We want to pair up an environment to establish a learning environment as a place where these highly preferred items are available. We want to make these new learning environments fun. When we pair an environment, we gather all the highly preferred items and place them in the environment. We freely deliver preferred items and give the child quality attention. You want to refrain from placing any sort of demands or questions on your child. And initially, keep these pairing sessions short, so no more than 5 minutes, or what your child can tolerate. Now, some of you might have behavior that occurs while you're pairing the environment, and in that instance, just neutrally block the behavior or ignore it. We want to give as little attention as possible to these interfering behaviors and spend all of our time and efforts on the new appropriate behaviors. So now that we've identified the child's reinforcer and paired the environment, we can start to teach the new skill. So when you have successfully set up an environment to begin instruction, it's important to make sure that you have the attention of your child. Have your child pick a favorite item to work for with either the paired choice preference assessment or the free operant. You're going to wait for your child to pay attention to you before presenting the instructions. For example, you may wait for their hands to be clasped at the table and their eyes on you. If they do not bring their attention to you, you can call their name or you can tell them eyes on me. But try to refrain from snapping or any other such actions such as banging on the table. When your child's attention is on you, you can present the instruction. Present the task item on the table equally spaced and do not touch the item after you place them down. Here you want to make sure that you say the instruction in short, clear phrases. For example, touch the horse instead of where's the tiny little horse, or touch the horse instead of touch the horsey. So if we go back to the ABCs of ABA, what we say or our instructions is called the antecedent. However, we may need to use something called prompting. A prompt is any hint or cue added to the environment to make it more likely that the learner will respond correctly. So it is how we teach a behavior. A prompt is given after the instruction or the antecedent, but before the behavior occurs. So there are different types of prompts. You can give verbal hints, for example. You can point to the correct answer, or you can physically guide your learner to do something correctly. So I'm going to review briefly 2 prompting strategies. This is more for informational purposes only, as your BCBA will help you identify which strategy is going to be most effective for your child. The first type of prompting is called most to least prompting. This means that we start on the left with the most help necessary. So in this case, a full physical prompt, or helping your learner to answer the question or perform the instruction. So if you're doing hand washing, for example, you might actually hand over hand help your learner turn on the water, put their hands underneath the soap, pump the soap, and then go underneath and hand over hand help them wash their hands. This goes all the way down to the least amount of help, which is the natural environment cue. So the cue for hand washing, for example, would be the presence of the sink. That is our cue that we need to wash our hands. The second strategy is flipped, and this is called least to most. Least to most prompting, it starts with the natural environment and then goes up to the most help needed, which is the physical prompt. This is best used for skills that are already mastered, but that are not occurring consistently. With both of these prompt strategies, our aim is to eventually fade out all of our help, or something called prompt fading. So this is the process of reducing prompts so that the learner responds independently. When your BCBA recommends a prompting procedure, they are also going to focus on how to fade these out so that your learner can become independent. So after we give the instruction, we prompt potentially, the behavior occurs. The third part of this equation is the consequence. So any consequence that follows a behavior and makes that behavior more likely to occur in the future is called a reinforcer. You will be incorporating reinforcement in all of the interventions that you choose. We want to encourage the appropriate behaviors and limit our attention and our efforts to the inappropriate behaviors. One additional strategy you can use is something called differential reinforcement. So this goes back to the prompting procedures or the helps or cues we give our child. If our child needed more help, we might provide some reinforcement, but not the most valuable reinforcement. So for example, if we asked our child, "What is your name?" and we had to fully provide them the hint of Sarah, we might provide them only 10 seconds of video. However, the less amount of help that they need, the higher rate of reinforcement. So if we say, "What is your name?" and all of the example or the hint that we have to give her is S, and she says Sarah, and this is the first time she has responded to that little of help, we might give her more time of the video. So we want to deliver higher reinforcement, especially when it is the learner's first time to give a response. Please note that every child learns differently, and we may see regression at some times. During regression times, it's important to increase our prompting and potentially even increase our reinforcement. If this is something that is a concern to you, I encourage you to discuss this with your BCBAD. So when you go through your instructional session, your child may make an error after you give her or him the instruction. There is something called an error correction procedure that you will use to have them respond correctly after they make the mistake. For example, if you say, "Give me the circle," and your child gives you a square, you could say, "Oops," or another reactive phrase that is lighthearted. We would encourage you never to say "wrong." You would then remove the instructional items from the table and rearrange them before you present them again to your child. You then say again, "Give me the circle," while increasing the amount of help you give to your child, or the prompt. So you might point to the circle in this case. And this is called a gestural prompt. If your child responds correctly, you can end that trial with neutral praise like "good." If your child is incorrect, you can repeat the sequence and give a higher level prompt. For example, a partial prompt, where you partially help them and guide their hand to the correct answer, or a full physical prompt, where you hand over hand help them point to the circle. So some prompting and reinforcement tips. In order to make the most of your instructional sessions with prompting and reinforcement, remember to focus on teaching one skill at a time. Also, keep in mind that your child may backtrack and regress at times. If you have questions, do not hesitate to contact your BCBAD or ask them during your meeting. Practice makes perfect, so practice every day if possible. Talk with your BCBAD about taking data on prompt levels to help you understand how to fade your prompts. And finally, don't forget to reinforce all appropriate behaviors with a variety of reinforcement levels. For example, you might consider using the differential reinforcement strategies. So now you are ready to meet with your BCBAD. Remember to identify up to 3 skills you'd like to target with your child. Please take notes on how they perform these skills already, or preferably a video to share with your BCBAD. I want to say that we look forward to working with you, and we look forward to our first meeting with you. And this final slide is just the references that we used for developing this curriculum.